Good morning and welcome to another episode of Coffee and Tea with AARP, a biweekly program in which staff and volunteers from AARP Connecticut speak with Connecticut decision makers about issues that impact older adults. Today, I am excited to be joined by Meari Avery, an AARP Connecticut volunteer from West Haven. She is also an RN and a family member of someone who has lived in a nursing home. Good morning, Meari. Thanks for being with us.
Good morning. Thanks, Anna. And thanks to everybody who took the time to come out and talk to us about nursing home care, staffing, and fiscal transparency.
Great. Thank you, Meari. And Meari really set up what we are here to talk about today. We have a big cast of characters joining us from 1199 SEIU and E. So I'm just going to go left to right on my little Brady Bunch screen here. We have Dawna Bernier, an elected organizer at 1199 SEIU and E. We have Corey Geisman, a political organizer. Simone Bell, a CNA at St. Mary's Home in West Hartford, and Natasha Royal, a lead organizer for the nursing home team at 1199. Thank you all so much for being here.
Thank you.
Thank you for having us.
All right, so we are just going to jump right in with our questions here. So to start our conversation, could you tell us a little bit about 1199 SEIU? You're a union, but who do you represent? And what does the union do for the workers that you represent?
I can jump in and take that question. So our union represents 25,000 members across Connecticut and Rhode Island. The majority of our workers, especially in Connecticut, Rhode Island might be a little bit different in some areas. We represent all healthcare workers. We work together to negotiate and enforce a contract with management. And these contracts are, to guarantee decent raises, decent starting pay, a huge one, affordable healthcare for workers, job security, and basically a guaranteed schedule for workers where they know, what they own for hours and what they're going to be paid, so they can live, a life of not worrying about if they're going to have a paycheck for the week. And, our union for the workers, we promote better working conditions.
Thank you. Can you tell us a little bit more about your work specifically with the nursing homes, and also are all nursing homes unionized? And it sounds like you don't represent all the workers in nursing homes.
Not all of the nursing homes in Connecticut are unionized. I believe we have, and Dawna, correct me if I'm wrong, about 61 currently in the union, and out that's 7,000 healthcare workers. No, we do represent the entire workforce. The majority of our nursing homes, it is wall to wall, including CNAs, dietary, housekeeping, laundry, receptionist, so a few rehab aides, unit, as well as unit secretaries.
So no nurses?
No, excuse me, RNs and LPN.
Okay. Oh, okay. Okay. Great. So what kind of work do you try and do with the nursing homes themselves? Dawna, you talked about contract negotiations. Do you also intervene if there are issues that come up during a year to assist your members?
That's everyday work for us. Enforcing the contract that's in place at a nursing facility, as far as wages, layoffs, eliminations of job positions, and so forth.
And I'm going to just jump in. And we are also very active in the political field, the political arena. There are many things that, we have to go to the politicians, the legislators of this state to make improvement. And today, we're here talking about staffing and transparency. These are things that our members, they want things changed. However, we can't do that within the nursing home. We have to reach out to the leaders of this state to vote upon this and to hear our workers, what they have to say about these situations. Because let's face it, the legislators of Connecticut are responsible for the individuals that live in long-term care.
Mm-hmm.
Yeah, that's a great setup for the next question that I had. So the reason that we brought you all here today is to talk a little bit about a piece of legislation that AARP and 1199, along with several other organizations, have been working on together over the past. It really probably going on a year. We've been having some of these conversations. And we're looking to pass legislation, this legislative session, that would improve financial transparency at nursing homes, increase staffing levels, and hold facilities accountable when they don't meet existing staffing standards. So let's start by talking about that issue of financial transparency. Why is it important for all of us to know more about how nursing homes are spending their money?
I'm happy to jump in if you guys don't mind. I think one of the biggest reasons, and maybe the chief reason why, it's more important that we have a better picture of how nursing homes are spending money is because many nursing homes are funded primarily through Medicaid, which is paid for by our taxpayers, right? And so when the state of Connecticut is thinking about how are we going to fund long-term care services, not just this year, not just next year, but moving forward for the next 5 years, the next 10 years. If we're going to truly be able to budget Medicaid services in the state and plan for our future as a state, we need to have a better understanding of how the current Medicaid expenditures that are going towards services such as nursing homes, how that money is actually being spent. I think there's also a history within the nursing home industry of some behavior that I think we would like to sort of at least infuse with a little bit of transparency. We know that it is common practice amongst the owners of nursing homes or the companies that own nursing homes to contract out critical services to what companies that are known as related parties. These are companies that can be that the owner themselves can own, be invested in, or I'm sorry, my cat is sort of invading here. But the point I'm trying to raise is that these are entities, these related parties that are related to the owner and in many instances financially benefit the owner. And so while sometimes these are nonprofit nursing homes, they are in fact making a profit through these related entities. And so we're hoping that some of the transparency provisions in this bill will help to alleviate that.
Great, thank you.
So that would be helpful. So it's in terms of, excuse me. So the more we know where money is going, the more we know whether it's going for direct care or not to direct care, which of course, as taxpayers, we want to see direct care, funding, not ancillary things that perhaps shouldn't be considered direct care. That's what I'm thinking about.
Absolutely.
Another provision has to do with staffing, and being in nursing for a long time, I understand the whole staffing dilemma, but right now the requirement is to staff at 3 hours per patient. And the proposal in Senate Bill 989, I think it is up to 4.1 hours per resident. Just wondering why you support this. I know why I support it, but from the perspective of 1199 and perhaps from Simone's perspective, why do we support a higher nursing staffing level, higher hours per resident?
Simone, do you want to take that question?
Well, based on my understanding of the ratio that they have now is it's per licensed staff. The licensed staff includes director of nursing, even if you're a maintenance, you're licensed, so it goes underneath that ratio. I think they need to change the ratio until the number, as you just said, per skilled nursing, like aides to one patient, because the aides are really the ones taking care of the patient directly. We are the ones that they talk to, they tell their problems to. They don't tell the director of nursing their problem. They don't tell maintenance their problems. So they need to have definitely more nursing aides as per se to nurses. Yes, nurses too, but nursing aides right now we're frustrated. I can give you a prime example for this weekend that we just had. We have an aide that she works very well, but she doesn't come to work that often because she doesn't have a babysitter. So right now they're looking to let her go, which is unfortunate because she really works well. I went to work on Saturday and I started on my unit for about an hour and a half. Then an hour and a half later, they're calling me to tell me that somebody didn't turn up. I had to move from that unit to go onto another unit with 30 patients with one aide. So I had to go up there, which usually takes 3 aides to do 30 patients. So already I've done a 1.5 hour. I haven't even taken a break yet. And I had to go on another unit to work short. And the other unit on the other side also has 30-something patients with 2 aides. And the nurses are overwhelmed. They didn't help with vitals. The aides got to do it. 2 aides over there were working the morning shift, already exhausted from working short, and I had to do a second shift short, and I was doing a double. So it is frustrating us. That was one of the examples, and one of the aides that I told you, she had to call up because she didn't have a babysitter to take care of her daughter to come in to at least relieve them. They still wouldn't have full staff, but I wouldn't have to leave one unit to go to another unit to work short and also to work the night shift. I had to call out yesterday because my knees were killing. So we really do. It's very important to raise that and
The
then
staff, yeah, the ratio, as you were saying, yes.
they need to take out the ratio and put staff to aid or nurse to patient care. So they take out the license out of it because it's a licensed staff that is into the ratio too that don't do patient care. So the ratio is gonna always be.
Can I jump
Thank
in
you
on
so
that
much.
question? I'm sorry. Can I jump in on that just briefly?
Yep.
You know, my past, I have been a caregiver. I came out of a nursing home. I came out in 2015. There has been such a change of the patients that are coming into nursing homes. And how do I know? I have, my children are in healthcare now. I hear from our members. It's the residents of yesterday have changed in huge ways. We have behavioral, we have substance abuse, we have alcoholism, complex diagnoses. You got to remember, hospitals used to keep patients for a week, 2 weeks. Now they're being immediately released into a nursing home. Well, with that being said, how can you take care of these individuals with 3 hours of care? I mean, seriously, think about hospitals with their patients. I mean, they're having problems too right now. However, they were allowed much more time with their patients. And these nursing home workers, I got to give them credit. They are doing the best they can right now, but this is not enough time to take care of the acuity of these patients that they're taking in as admissions right now.
Yeah, and then even on Sunday morning, I had to work in the night, as I said. There's this patient, she's always screaming and shouting. Remember, you have a floor full of patients. You don't want them to, wake up. I had to sit in the room with her so she's comfortable while listening to the call lights in the hallway, coming up periodically, checking on the other residents, making sure they're okay. There was another patient that left off another unit, came down on our unit. I had to find where she came from. So it's like I'm doing 3 jobs in one. And it was frustrating. I was really, really frustrated yesterday. I had to call her because I was really exhausted. So it's not easy.
You bring up wonderful points and wonderful real life in time examples so that the rest of the community who's never worked or looked at what that's like can begin to understand the necessity of increasing staffing, increasing more hours. So not just that though, a related question is, how do we find staff? You know, it's availability of people to provide for our most vulnerable in nursing homes. Nationwide, 210,000 workers nursing homes have lost during the pandemic. That is a huge, huge population. We've seen similar across healthcare. So why are healthcare workers quitting, and what do we need to do to rebuild?
Okay, so I have spoken to a lot of workers because at my job, a lot of people come and they go. I'm a union delegate there, so a lot of people come to me with their issues. Majority of our issue is the pay. That's one thing. So you have some private companies are paying more. You have other companies paying the same amount of money that they're getting to come and take care of 30, 15 patients hurting their backs. A lot of my coworkers are out because their back problems, shoulder problem. A lot of people are even retiring early because they're tired. So one of the things is they need to raise the pay. It has to be livable. The pay is not livable at all. You can't do much. You have to do 2, 3 jobs to make ends meet. So that needs to cut out. And most of the students that are leaving school, coming into the field, they don't want to stay in there. They're all going to school. So sooner or later, you're not going to have aides. You're going to have LPNs doing patient care. And then they don't want to do it either. So they have to make this profession livable enough that people want to leave school and go into this profession. It's not the same. The older people, when they're gone, they're not going to be anybody to take care of the residents because they don't want to do this work.
And if I may add, you know, there is certainly a relationship between staffing levels and a nursing home's ability to retain the talented caregivers that they have. You know, when you listen to Simone talk about her knees hurting, or, you know, coworkers who are dealing with injuries, you know, that is all a factor of the staffing levels. And, you know, when nursing homes are able to get talented caregivers into the doors, it's hard to retain them because like Simone said, with the pay not being livable, and the quality of sort of the safety of the work environment is not always, you know, where it needs to be either, and that's directly tied to staffing.
Great. Thank you so much, Simone, for sharing your experiences. And yeah, we know that there is a lot that needs to be improved in nursing homes, both for the quality of the work experience for workers, as well as for the care of the residents who call these nursing homes their home. And we've covered a lot of ground during this conversation. Unfortunately, we're you know, running out of time for today. So I just want to mention again, SEIU and AARP Connecticut have been working really closely with a really great set of partners to get the legislature to pass SB 989. We can post a link to our action alert for this particular piece of legislation in case folks are interested in reaching out to their elected officials. But thank you all so much for taking the time to be with us today. I want to say special thank you again to Meari, Dawna, Corey, Simone, and Natasha for taking time to share your expertise and experiences, and to really dive into an important issue that is going to take really years to to dig in on and make sure that we can improve conditions both for nursing home residents as well as workers. So thank you all so much for being with us today.
Can I add one thing? And it will impact all of us individually if we don't get this right. it will impact our families, our friends, or ourselves. So we need to get this right in Connecticut. So that's my addition.
I have one
Absolutely
addition
perfect.
too. I have one quick addition. Please remember our residents that don't have family members. It hurts
Mm,
that we have to take care of them and we don't have enough time. So please
mm,
remember the
good point.
residents' family members are not with them and we have to be their family members.
Hmm. Thank you.
Wonderful. Yeah,
Thank
and
you
that's-
all for all you do.
And that is the perfect note to end on. Thank you so much to all of you for making the time to be with us today. And we hope that everyone will join us again in 2 weeks for our next episode of Coffee and Tea with AARP. Thank you so much.